Look, I need to be straight with you about something. I'm not a doctor. I never went to medical school. What I am is a 64-year-old guy who spent 37 years building things, managing people and operations on job sites across Tennessee. I'm retired now, and I've had real wake-up calls about my own health that changed how I think about aging. Here's the truth. Most people over 60 aren't thinking about what happens if they have a heart attack while they're alone. But when it comes to heart health, you've got maybe minutes to make decisions that could save your life. My father, he was a heavy equipment mechanic. Smart man, strong man. But when he got into his 70s, things changed. He became frail and lost his independence. Watching that terrified me. My older brother Daniel developed type 2 diabetes in his 60s with serious mobility problems. That's when it hit me. Healthy aging isn't something that just happens. You have to be intentional about it. In 2019, I went in for a routine checkup. My doctor looked at my numbers, borderline hypertension, early insulin resistance markers, and said something I'll never forget. He said, "Jack, you've got a window here. This is the time to act." That was my wake-up call. That visit changed everything. If you don't know what to do when a heart attack happens and you're alone, you could lose precious minutes. Every second counts. Not because I'm trying to scare you, but because the science is clear. There are real science-backed actions you can take right now that can keep you alive long enough for help to arrive. Not gimmicks, real strategies that cardiologists teach their own patients. I want to walk you through 7 of them today. These are the steps I wish I had known about earlier, and they're things I've talked through with my wife Karen, because if something happened to either of us, I want her to know exactly what to do. By the end of this video, you're going to understand what each of these steps does, why they matter, and how to act if the moment ever comes. So let me start with number 7. This is the very first step that could decide if you make it out alive. Number 7, call emergency services immediately. Don't wait it out. Don't second guess yourself. The very first thing you need to do when you feel signs of a heart attack is dial 911. Not your wife, not your neighbor, emergency services. Right now, not in 5 minutes, not after you wait to see if it passes. Here's what I learned. Every minute you wait, the damage gets worse. The blood flow to your heart is blocked. Your heart cells are dying. And the longer you wait, the less of your heart survives. Your doctor calls this time is muscle. The faster you get help, the more of your heart you keep. The American Heart Association says patients who call 911 within the first 5 to 10 minutes of symptoms have survival odds that are 50% higher than people who wait. 50%. That's not a small difference. But here's what breaks my heart about this, and I mean that literally. Studies show that nearly 1/3 of people over 60 wait more than 2 hours before they even call for help. 2 hours. Why? Sometimes they think it's indigestion. Sometimes they're tough and think they can push through it. Sometimes they don't want to bother anyone. I understand that instinct. I spent my whole career being the guy who toughed things out. But this is different. This is your life. I read a story about a 68-year-old grandfather in Ohio. He felt pressure in his chest one evening. He told himself it was probably nothing. Maybe he ate too fast or something. He drank some water, sat down to rest, and he waited. Hours went by. By the time his daughter found him and called 911, it was too late. The damage was done. And his daughter told his doctor, if he had called right away, he would have made it. That story haunted me because it happens all the time, and it's preventable. So here's what I'm saying to you. If you're over 60, and you ever feel crushing pressure in your chest, sudden shortness of breath, unexplained nausea, or that cold sweat that doesn't make sense, act like it's a heart attack until proven otherwise. Pick up the phone. Call 911. Don't hesitate. Even if it turns out to be indigestion, you've lost nothing. You've wasted maybe an hour with some paramedics. But if it is a heart attack, and statistically, the odds are it could be, you just took the single most important step to save your life. But while you're waiting for those paramedics to show up, what you do next can keep your blood moving and buy you even more precious minutes. That's where number 6 comes in. Number 6, chew an aspirin if you have one and you're not allergic. Once you've called 911, the next move might be the difference between life and death. And it's sitting right there in your medicine cabinet probably. Once you've called 911, the next move might be the difference between life and death. and it's sitting right there in your medicine cabinet, probably. Aspirin isn't just a pain reliever. During a heart attack, aspirin is one of the most powerful clot-fighting tools you can get without a prescription. Here's what happens. A blood clot blocks blood flow to your heart. Aspirin thins your blood and stops that clot from growing. A major study in The Lancet found that taking aspirin during a heart attack reduced the risk of death by 23%. But here's the thing, speed matters, and this is where most people get it wrong. If you swallow an aspirin whole, it takes 10 to 12 minutes to break down in your stomach. That's too long. But if you chew it, you break it apart instantly. The active ingredient gets into your bloodstream through your mouth and stomach lining in just minutes. And when we're talking about a heart attack, minutes matter. I knew a retired bus driver. He was 70. He was alone in his living room when he felt that crushing pressure in his chest. He remembered his doctor telling him about aspirin. He went to his medicine cabinet, grabbed an aspirin, chewed it, and called 911 while he was doing it. The paramedics told him later that simple action kept his blood flowing just enough to prevent major damage. 2 weeks later, he walked out of the hospital alive and still independent. Now, if you have an allergy to aspirin or a bleeding disorder or your doctor has told you not to take it, then skip this step. But for everyone else, keep a bottle of regular, uncoated aspirin in an easy-to-reach place. That's one of the smartest emergency precautions you can take. Doctors usually recommend one 325 milligram tablet. That's it. Think of it like this. You're sending in a rescue team to slow down the disaster until the big guns arrive. It doesn't cure the heart attack, but it can stop the damage from spiraling out of control. And that matters. Number 5, loosen your tight clothing and sit upright. It sounds simple, but it can reduce the strain on your heart significantly. When a heart attack strikes, the way you position your body affects how much your heart has to work. One of the simplest yet most overlooked things you can do is loosen tight clothing and sit upright. I think about this because of my years on construction sites. We were always pushing our bodies. We were always wearing heavy belts, tight waistbands, the whole thing. And I didn't think much about it then. But here's what happens during a heart attack. Tight clothing compresses your blood vessels. It makes it harder for your body to circulate oxygen-rich blood when it needs it most. You're already struggling. Why make it worse? Sitting upright, not lying flat, relieves the pressure on your diaphragm and lungs. It makes breathing easier, and it reduces the workload on a heart that's already struggling for its life. The European Heart Journal found that sitting upright during cardiac distress reduces pulmonary congestion. That's fluid buildup in your lungs. When you're upright, air flows better. Blood flows more effectively. Your heart doesn't have to work as hard. So if you ever feel those signs, chest pressure, shortness of breath, cold sweat, sit upright. Relax your shoulders. Free your chest and waist from restriction. Give your heart room to breathe. That adjustment buys you stability, and stability buys you time. Number 4, cough strongly if you feel faint. You can keep blood flowing to your brain temporarily. I'm going to be honest with you. When I first read about this, I thought it sounded too simple, almost silly. But the science is real, and it's powerful. If you feel faint or dizzy during a heart attack, coughing, yes, coughing hard, can sometimes keep you alive long enough for help to arrive. Doctors call it cough CPR. Here's how it works. When you cough deeply and forcefully, your chest muscles contract. Your diaphragm compresses. Pressure builds inside your chest, and that pressure forces blood out of your heart and into your brain, keeping you conscious when your circulation is collapsing. Now, let me be clear about what this is and what it isn't. This is not a replacement for medical treatment. It's not a cure for a heart attack, but it can buy you valuable seconds if you feel like you're about to pass out before paramedics arrive. And those seconds matter. There was a study in the Journal of the American College of Cardiology that looked at patients experiencing cardiac arrhythmias. The ones who coughed and coughed hard every 2 to 3 seconds stayed conscious and maintained their blood pressure until emergency treatment could take over. In some cases, just by coughing, patients stayed alert for several minutes when they otherwise would have blacked out. I knew a 69-year-old retired mechanic in Texas. He felt a sudden wave of dizziness during what turned out to be a massive heart attack. He was alone in his workshop. He remembered hearing about cough CPR somewhere, so he started coughing forcefully over and over. He stayed conscious the whole time until paramedics arrived. His doctors later told him that those coughs probably prevented him from collapsing and suffering brain damage before they could restart his heart. Here's the science in plain terms. When you faint during a heart attack, it's because blood flow to your brain drops suddenly. When you cough hard, you're basically creating artificial heartbeats with your chest muscles. It's like squeezing a pump with your whole upper body. It won't stop the attack, but it keeps oxygen flowing to your brain long enough for the professionals to take over. If you ever feel your vision narrowing, your head spinning, your body going limp while you're having chest pain, try this. Take a deep breath, then cough hard and strong like you're trying to clear your lungs. Do it again every 2 to 3 seconds until the dizziness passes or paramedics arrive. Think of it as manually keeping your heart in motion when it's struggling. This unusual technique has saved lives, real lives. Number 3, unlock your door and keep your phone nearby so help can reach you quickly. When a heart attack strikes, every second is precious, and one of the most overlooked survival steps is also one of the simplest. Unlock your door. Keep your phone within arm's reach. I know that sounds small, but in a crisis it can mean the difference between being found in time or being trapped behind a locked door while minutes slip away. Paramedics can force their way through, but that takes time, and during a heart attack, time is what you don't have. The research is clear. For every 10 minutes of delay in treatment, survival rates drop by nearly 10%. Every single minute costs you. So removing barriers like an unlocked door can literally save your life. During a heart attack, even walking a few steps can cause you to collapse. Having your phone right there means you can stay connected with emergency responders. Some people even put their phone on speaker so they can follow instructions without holding it to their ear. Think of it this way. Your phone is your lifeline. Your unlocked door is the bridge that gets help to you faster. Together, they eliminate barriers and buy back time you cannot afford to lose. Number 2, take slow, deep breaths. It lowers the stress on your heart and oxygenates your blood. In the middle of a heart attack, panic is your worst enemy. When fear takes over, your body goes into fight or flight mode. It releases adrenaline and other stress hormones. Your heart rate spikes, your blood pressure shoots up, and your heart, which is already struggling, has to work even harder. That's why one of the simplest survival actions you can take is also one of the most powerful. Breathe, slowly, deeply. Here's what that does for you. First, it gets more oxygen into your blood and your brain. Second, it sends a signal to your nervous system to calm down. It lowers that surge of stress hormones that put extra strain on your heart. Research from the Journal of Cardiopulmonary Rehabilitation and Prevention shows that slow, controlled breathing reduced heart rate and improved oxygen delivery, even in patients with advanced heart disease. Here's how to do it. Place a hand on your stomach, not your chest, your stomach. Breathe in deeply through your nose. Feel your belly rise. Then exhale gently through pursed lips, like blowing through a straw. Aim for about 6 to 8 breaths per minute. Slow, controlled, deliberate. This kind of breathing, they call it diaphragmatic breathing, keeps your mind focused when panic wants to take over. Think of each deep breath as buying yourself more time. Number 1, stay as calm and still as possible. Movement can worsen the damage during an attack. When a heart attack strikes, your first instinct might be to move around, to pace, maybe even to try and walk it off. But that instinct can be deadly. Here's the survival rule. Stay calm. Stay still. Every step, every sudden movement forces your weakened heart to pump harder. And during a heart attack, your heart is already fighting for its life. When you keep your body still and calm, you reduce the strain. You conserve oxygen. You give yourself the best possible chance of surviving until help arrives. The science is straightforward. During a heart attack, blood flow through the arteries feeding your heart is blocked or severely reduced. When you move, you demand more oxygen from your heart muscle, but its supply is cut off. So that extra demand just increases the damage. A study in the European Heart Journal found that minimizing exertion during a heart attack reduced complications and improved outcomes. Calmness isn't just physical, it's mental. When you panic, your body floods with adrenaline. Your blood pressure spikes. The attack gets worse. But when you stay still and practice those slow, deep breaths we talked about, you lower that hormonal surge. You help keep your body stable. Tell yourself something like this: I called for help. My only job now is to stay still and breathe. That mindset prevents rash decisions. Decisions like trying to walk to the door or grab something across the room. Actions that can trigger collapse before help ever arrives. Think of your heart during a heart attack like a fragile engine running on fumes. Every movement revs the engine faster. Every movement risks breaking something that's already broken. Stillness, calmness, conserving every ounce of energy. That's what keeps you alive. That's what buys you time. Do less. Breathe more. Let help reach you. Together, these 7 tips form a survival map. You can't predict when a heart attack might strike. None of us can. But knowing exactly how to act, that changes everything. That's the difference between tragedy and survival. So let me recap what we've covered. 7 life-saving tips every person over 60 should know. Call emergency services right away. Chew aspirin if you have it. Loosen tight clothing and sit upright. Cough strongly if you feel faint. Unlock your door and keep your phone nearby. Take slow, deep breaths. And finally, stay as calm and still as possible. Each of these actions buys you precious minutes, and those minutes can mean the difference between life and death. That's not hyperbole. That's just the truth. Here's what I want you to remember. A heart attack doesn't always give you a second chance. But if you act fast, think clearly, and follow these steps, you can survive. You can live to see tomorrow. And that's why I'm talking about it. Because I want my grandkids to grow up knowing that their grandpa and grandma had a plan. I want them to know that when things get scary, you don't panic, you act. So here's what I want from you. If this mattered to you, if you're thinking about your own health or the health of someone you love, share this video. Send it to them. Have a conversation about it. Don't wait until it's too late. And in the comments below, I want to hear from you. Do you have aspirin in your home right now? Do you have an emergency plan? Have you talked to your family about what you'd want them to do? Drop your answer below. I'm serious about this. I read the comments. Your story matters. What you share might just help someone else stay alive. Don't forget to like this video. Subscribe if you haven't already. And if you know someone over 60, send this to them. Knowledge is power. Being prepared. Actually knowing what to do. That's the best insurance policy you'll ever have. Thanks for watching. Stay safe. Stay prepared. You don't need anything extreme. You just need to know what to do and be ready to do it when it matters.